We are reconvening, and I want to note that we have a couple of members on Zoom this morning, and then we have one member, Jan Lee, who may not be able to join us until around noon time. So the rest of us are here and we are ready, and I see that our first group, which is the Health, Housing, and Human Services, H3S, as we so lovingly like to call it, with our new interim director. So, Rod, you are ready to go.
Good morning, Budget Committee members. For the record, I am Rodney Cook, Interim Director of Health, Housing, Human Services, also known as H3S, so we'll be referring to H3S throughout the presentation. To my left is Ed Johnson. He's our Administrative Services Manager. So he's going to help me out today on a few of the slides. And in the Zoom, on Zoom, we have our directors of each division. So if we get into some very detailed questions, they'll be available to you to answer questions. We have Mary Rumbaugh from Behavioral Health, Adam Freer from Children, Family, and Community Connections, Deborah Cockrell from Health Centers, Mark Soroy and Pamela Anderson from Community Development, Philip Mason Joyner from Public Health, Brenda Durbin, Social Services, and Jill Smith, Housing Authority. Committee members, I am honored to have been chosen to lead a department that has at its core mission to serve the homeless, those without the means to feed their families, those experiencing mental health and addiction struggles, veterans with PTSD, and others with developmental disabilities, young parents and their children, and the population at large looking to government to access health services and safe environments. This budget reflects a strategic investment of $10.3 million of general fund that in effect leverages another $190 million from outside sources providing services to our most vulnerable community members. Slide 1 lists our major accomplishments. Departmental-wide pandemic and emergency response, we're really proud of what we did this last year through all of the emergency situations, whether it be the ice storm, the fires, or COVID-19 itself. Public health is helping to lead the county's local response to COVID-19 with disaster management through and in coordination with county departments, local municipalities, regional, state, and federal partners through the county's Emergency Operations Center. Many other H3S divisions are shouldering large roles and or have redeployed staff to assist in ways above and beyond their job duties. An example of that would be the EOC logistics and contact tracing. The department serves similar roles in response to the September wildfires and the ice-related power outages. Behavioral health just won an award, I believe, for this one from NACO. They successfully lifted up the GO teams, now called Clackamas Safe and Strong, providing emotional support to individuals impacted by COVID-19, wildfires, and ice storms. CARES Act funding allowed partnership with local culturally specific organizations to develop GO teams for their communities and allowed for the purchase of equipment to assist older adults to virtually connect with the community. Children and families, when the state shut down to slow the spread of COVID-19, the parenting education program moved parenting classes to a remote environment. County staff served as leaders in remote parent education and assisted several other county partners make the switch to remote learning. Parenting education offerings were expanded to include strengthening families and evidence-based substance abuse prevention program. Remote learning allowed CFCC to serve more parents throughout the county. Health centers, telehealth and innovations. Health centers stood up a telehealth program for primary care, behavioral health, and dental telehealth visits. Health centers provided 28,671 telehealth visits and have received very high satisfaction scores from the patients. It also developed innovative approaches to providing care to patients, such as outdoor childhood vaccine and dental screening clinics, and it implemented the first COVID-19 testing site in the county. Public health, that were re-accredited this year. successfully completed a review process to maintain national accreditation status through the Public Health Accreditation Board. FAB accredited health departments demonstrate great leadership by placing their work for peer review with the goal of using the feedback obtained during the process to improve the services they provide in their communities. Social services, food and rental assistance. Social services worked with community partners to establish a food box delivery program for households who were unable to access food independently due to health conditions or concerns or the economic impact of COVID-19. 23,408 food boxes were provided to 16,974 households with the assistance of 5,321 volunteer hours. The division also provided $3.2 million in rent assistance payments to 671 households that were impacted by COVID-19 in a manner that prioritized communities that are most impacted by the pandemic. Next slide, please. As you're aware, 2020 was unlike any other in recent memory. H3S was stretched and challenged in many ways, serving key roles in emergency command and throughout Clackamas County. Many of our divisions continue to be at the forefront of COVID-19 and emergency response, working multiple vaccination sites and introducing innovative approaches such as telemedicine and emotional support teams to the community. These next two slides present a few examples of H3S set of performance Clackamas measures. COVID-19 did affect performance on some of the metrics, but overall we were able to maintain services and our customer focus. Where we did experience a slight drop in performance, we attribute those drops to client access due to self-isolation and or social distancing requirements. A few things I'll highlight from our performance Clackamas. Behavioral health, safety net services. That measures the percent of safety net clients receiving jail diversion services that do not get rearrested in Clackamas County within 90 days. And as you see, we met that metric. Another one we're proud of is CFCC in the prevention area, percent of clients with domestic violence safety plans. We met that metric, and that's it's critical to get a safety plan for people who are experiencing domestic violence so they know where they can go live safely, how they can exit from the home they're in. It's a major strategy that has to be put in place, or a plan to put in place to make sure that people are moving through that experience without suffering the dire consequences. CFCC workforce, 55% of the job seekers in the county funded programs will retain employment for 90 days. So that is a successful program that you fund, and I'll talk about it a little bit later, but that's one that gets I'll say a significant amount of the general fund. And so they work with veterans who have brain injury, PTSD. They work with individuals coming out of corrections. They work with the job employer to actually set up a system where if the person has difficulties while they come to work, we have a coordinated effort to help that person maintain that job. And health centers, pediatric clinic and school-based, that measures percent of child patients, age 2 and younger, will have a complete immunizations. And if you can, and we met that metric. We're a little bit under on that metric. Let me see. A little bit under on that one. But if you can imagine, this is where parents were not bringing their kids to the clinics or at school, so that kind of affected that. And we now that they're bringing kids back, we believe we'll be able to catch up on that measure this upcoming year. Housing and community development, that measures the percent of houselessness individuals served by the CLC, which is basically a eligibility platform that allows people to call one number, and you have all the coordinated services attached to that system. So we get the name in, we get the people, and we get them situated with housing, some sort of housing. Public Health Center for public health advancement. This one has to do with percent of response time compliance achieved every month. And they measure it separately on the types of priorities, but these are basically calls for ambulance service, and basically we're meeting our metric in that area. I'll say last but not least, social services. The return on investment, we always wonder, like, if we're doing strategic investments, what are we getting in return for that? And the claim dollars generated for every county general fund dollar spent on the county Veterans Service Office, so we measure that, and that's $17.50 that we get back, or $17 we get back for every dollar invested in that program. Next slide, please. In our program profile area, I'll just highlight a few things, but we basically have, H3S has 7 lines of business, including the component unit housing authority that we discussed on Monday. Those 7 lines of business include 31 programs overall, which includes 1 for HAC. That's the housing authority. 20 of the H3S's programs will use some amount of general fund support to provide and deliver services. Prevention services, workforce, population health strategies, and veteran services being the most dependent on general fund support. 29 of H3S's 31 programs have restricted funding, with 21 of the programs using 80% of restricted funding to support and sustain their budgets. 22 of H3S's 31 programs have either a federal, state, or IGA mandate. With varying percentages, all of H3S programs are operated by county H3S. And so that might be an administrative function where you're outsourcing most of the dollars, or in some cases like social services where you have more direct services occurring. 10 programs specifically mentioned COVID-19 as a factor where their program metric performance fell short. Next slide, please. And I'm going to have Ed Johnson go over the next few slides, and then I'll be back with you.
H3S's FY22 budget is $200 million. H3S supports and sustains its operations with grants, awards, charges for services, i.e. fees, and county general fund. County general fund support is $10.3 million, or 5.1% of H3S's total budget. The lion's share of H3S's budget is supported by federal and state grants and awards and fees, which is $191 million, or 95% of its total budget. There are no fee increases included in H3S's proposed budget. The budget does include $24.5 million in estimated funding from the Supportive Housing Services Measure 26210. H3S will work closely with the County Budget Office to make any adjustments to align with any funding changes prior to budget adoption. The beginning fund balance is offset by contingency of $18.1 million, and for materials and services, i.e. personnel, covert response, rental assistance funding, and contracted services. 93% of the beginning fund balance is restricted. On the expenditure side, capital outlay is $4.5 million, and is for the construction of the new Sandy Health Clinic. Special payments is $38.6 million, which includes $24.5 million for the Supportive Housing Services Measure 26210. These dollars are pass-through funding for contracted services. Next slide, please. Summary of revenue and expenses. I'd like to draw your attention to that there is a 29.5% increase in the beginning fund balance, which is carryover of federal CARES funding that were awarded to several lines of business within H3S. There is also a 287.9% increase in all other revenue resources, which is attributed to how reimbursements will be accounted for going forward, which includes $850,000 reimbursements from community partners contributing to their portion of project costs, i.e. community facilities and street projects that are funded through community development. There is a stark decrease of 96.6% in other interfund transfers, which is attributed to how the general fund will be accounted for going forward in its own line item, which is general fund support. There is a 570.6% increase in capital outlay, outlay. Again, that is for the new Sandy Health Center. There is also a 107% increase in special payments to account for the supportive housing measure. And the last two, there is a 100% decrease in reserve for future expenditures, which is attributed to health centers transferring these funds to contingency in order to use them more readily. Funds budgeted in reserves requires VCC approval to access them. And then the offsetting entry, there is 103.7% in contingency, an increase, which is attributed to health centers transferring from reserves. Next slide, please. The department's summary by fund provides an overview of FTE, budget, and general fund by MFR program. H3S relies on county general fund of $10.3 million to deliver programs and services to the most vulnerable populations in Clackamas County. Next slide, please. Or if you can go back one slide, I'm sorry. At the bottom of this page, under the column FY 21-22 at the very bottom, it reads that there's 3,371% increase. This is a printed calculation error. So the $4 million shown for FY 2021 budget, it should actually be $122.7 million. The fund truly or accurately increased only by 15%. The majority of the 15% increase between fiscal years is attributed to the supportive housing services funding. And then next slide, please. As discussed on Monday, the Housing Authority is a component unit of the county and a division within H3S. Their fund is shown separately here and has not traditionally been included in H3S's budget total, but we want to recognize that it is part of our department.
Next slide, please. So significant policy and or financial issues. We have the American Rescue Funds that will come, some will come to county and some will come to some of our divisions. And so we are still waiting information about that from our national and state agencies on additional funding to support COVID-19 contract tracing, testing, vaccine distribution, and other emergency response efforts across H3S. Specific dollar amounts are unknown at this time, but we do expect that to be unveiled at some point. A next big issue for us is environmental health licensing program. Due to COVID-19 restrictions for environmental health licensed facilities, these would be restaurants, swimming pools, et cetera. If in FY 2021, Clackamas County allocated CARES dollars to provide a cost reduction in annual licensing fees rather than adopt an annual fee increase. Public Health is recommending a freeze on any fee increase for fiscal year 21-22. However, further analysis and evaluation will be needed for long-term sustainability of fees to achieve full cost recovery. And then last but not least, but this has been mentioned, but I'll mention it again for the record, this budget includes the $24 million in supportive housing services funds. We're currently working with Administrator's Office, Finance, County Council to gain more clarity on the supportive housing services funding coming from Metro. And that concludes our presentation.
Thank you very much. Very concise and informative presentation. And we're great on time, too, so I appreciate that. The first one that has a comment is Chair Smith, and then we'll have Mr. Feely.
Thank you, Chair Parks. Thank you for your presentation today, but more deeply, I'd like to thank all the employees in H3S who have worked endlessly through these 3 declared emergencies. We couldn't do this job without you. We need you, And we want you at Clackamas County, and I want all the employees to know that. We are still under a state where the rules of the pandemic are going on, and frankly, we're all growing weary. And we just need to gut through the last part of this, and brighter days are ahead of us. To the employees, you have served faithfully, and you are indeed our true heroes, and I want your folks to know that, Rod.
Thank you so much for that.
Yeah, it's amazing to me how they've been able to turn on a dime and set up a clinic here or set up a warming shelter here, just as a phone call and it's done. And it just makes me want to cry at times when I see the dedication. I have a couple questions, and Ed, I'm going to start with you. On page 11, you have a contingency moving forward, and I want that addressed today, Elizabeth, because in light of the discussion we had yesterday on a budget that had no contingency, can that be addressed in light of my questions yesterday, Elizabeth? And Ed, you don't know about that, but can you explain the reason for the contingency? I think it's 18 million.
Yes. So 10.5 of it, so majority, 94% of the contingency is restricted. 10.5 million of it is in the health centers, and health centers maintains a 90-day reserve. These are Medicaid, Medicare dollars that they generate through providing direct services to patients. And then 4.8 million of it is for behavioral health. And these are restricted dollars through the state, through the QMHP. Social services also has restricted dollars, and community development as well. It has to maintain $640,000 for borrowers of federal dollars for home improvement projects. So if a homeowner defaults, this is what is set aside for that purpose. And then public health has restricted emergency management services dollars.
So
Thank you for Ed. Elizabeth, please address this issue for me.
yeah, absolutely. So good morning, this is Elizabeth Comfort, Finance Director with Clackamas County. And so yesterday we were talking about, we had 19 departments that reside within our general fund. And so H3S, they have a few funds as well as that they've shown on their presentation, but each fund is kind of represents a standalone. So each fund will have its own contingency. So those 19, and today we're going to see a lot of the internal services departments and funds or departments that reside within the general fund, and you'll see that they also do not have contingency. But the H3S, they have their own funds because of their revenue sources, and so those require to be in their own fund structure, and then each fund structure has its own contingency amounts. So like yesterday we were talking about the sheriff's office, they're not showing a contingency within their department, but they're part of the greater good of the general fund, and so the general fund has adequate and by our policy, the commissioner's policy, what those reserves and contingency should be. So those contingencies in general fund support the finance department, they support the sheriff's office, you know, the variety, all the 19 departments within. So it really depends on where that department is residing. If it's in its own fund, that fund will have a contingency and reserve, or if it resides within another fund, the department, then it'll also have a contingency for that fund.
We have a comment.
Gary?
Sorry, can I add to this? So this is actually a policy change I requested last year to the Budget Committee and the Commissioners, and last year they agreed. That is, if a department has restricted dollars from a state or federal source, they may keep that in contingency within their department. If it is a general fund contingency, it is returned to the general fund. It does not stay within a department. So the Board of Commissioners decides how to spend it, not the department director. That was my request to simplify things. So any contingency you see in any department now is because it is a state or federal restricted purpose. If it is a general fund carryover or contingency, it goes back to the general fund. The Board of Commissioners, you decide how to spend those through the supplemental budget process during the year. I wanted to return authority back to the board rather than having it reside with departments.
Thank you
That makes
for that.
sense, and Ed's explanation was, I know where that's coming from now, and thank you. And so any department that comes up that has a contingency, I want to hear about that. I would also, at the end of this process, like a list of those departments who carry contingencies based on restricted funds from the state or the federal government, because I think that's important to know. Also, my last question, I think, on page 14, we have the Housing Authority budget. And the numbers are the same as we looked at this week. We have an increase of about 62 million. I assume that's the Metro Bond Authority that has not realized or materialized itself. My question is this, Gary. If we approve this budget with page 14 inserted in that, how does that jive with what the decision that we made this week on not approving that budget and waiting until we have more information?
Yes, so the budget is a framework on anticipated funds, and you're correct, we don't have these funds in hand yet, so you could decide, we could strike this entirely and do it through the supplemental budget process once the funds are received, or you could keep it as a placeholder knowing that it's anticipated, but it is not in hand. You are absolutely
Well,
correct.
I would like to strike it, because if we go ahead and rubber stamp this, what's the accountability coming forward in June? There won't be any. And for transparency and accountability, I'm going to suggest to this board that we strike page 14. It stands alone as a housing authority. And I know there's commissioners working very hard right now on this particular item. And I think that's really important, Gary.
All right, so we'll make the note of that for deliberation tomorrow, and we can have the committee make that decision.
I made a note of that also to put on our notes for tomorrow, so thank you.
Chair Parks. And that's all I have.
You have a light, I think.
No, do I have a light?
In queue, we have first Mr. Feely, and then Christina has someone in queue. So, Mr. Feely?
Thank you, Madam Chair. I have a question, and if you go back to page 4, the top performance measurement there, your projected performance for the current year is higher than your target and higher than what you're projecting for next year. So is that somehow COVID-related?
Which line item?
It's the behavioral health division. It's the very top performance measurement on page 4. If you look under 2021 projected, you're hitting 82%, but your target for next year is 70.
And if you don't mind, I'll have Mary Rumbaugh answer that
Sure.
question so you can get a very detailed answer. I think Mary should be available via Zoom.
I'm bringing her in now.
Okay, thank you.
She's coming.
I can speculate, but I'd rather her give you.
All right, go ahead, Mary.
Good morning, Mary Rumbaugh, Behavioral Health Director for Clackamas County. So I think we actually were a little surprised by our projected performance measure, and this has actually been positively impacted by COVID in the sense that we did not see as many re-arrests because the jail had limited access.
Okay.
So we will need to be, 70% is probably a realistic target. That's pretty consistent with what we've had in previous years. So I think it's a little bit of an inflated projection just because we were able to actually just keep folks out of jail just by virtue of the pandemic.
Okay. Well, yeah, and the sheriff yesterday spoke about forced releases because of COVID restrictions in the jail. So I was kind of wondering if that's what it was. But thank you.
You're welcome, sir.
Okay, and we have Christina, and then Commissioner Shull, and then Commissioner Schrader.
All right, Commissioner Savas has his hand raised.
Thank you.
Yeah, thank you. I did want to just build a little bit on what Commissioner Smith had raised with regard to the contingencies. For some of those, for those of you who remember, I had, when we did budget, I always took my little notes and added up all those extra contingencies. And really what I was trying to make the point, and I think maybe it was recognized by the administrator, I think so, was that we were actually having double contingencies. So with all the belt tightening and all the requirements for resources, I think we've been able to capitalize on, putting those dollars to better use and trying to meet and get our budget more sustainable and structurally sound. So I appreciate staff's work on that. What I did want to just mention to everyone, again, I said it yesterday when the sheriff's office was present, but I do want to say that, as we can see this large amount of influx of dollars that have come in this year in this anomaly, as I mentioned yesterday, with all the federal assistance, my appreciation and I just want to recognize all the staff that had to go through all the processing and filing and to meet all these requirements for these dollars and to administrate it. It's not an easy task. It was, I just think, a yeoman's work on everyone's part and across all departments. But when you see these amount of dollars coming in, there's a lot of work associated with that. And again, I just want to recognize everyone's great work. It's very difficult this year, really, when we start comparing year over year because, again, of all this money, and especially in this particular department of the county. It's going to be an oddball, and we're going to have to just be, I think, a little bit more understanding of some of these numbers. And unfortunately, it perhaps for a couple of years to come, it may even skew our performance measures in interesting ways, just as Mary Rumbaugh just cited just one of them. And so hopefully we'll be in a better place and we'll get some consistency. But I think for our comparables of comparing one year over another, it's just going to be, it's going to take a couple of years probably to get a better, cleaner look at where we're headed and our trends. And hopefully some of these funding streams that we have, these one-time only funding streams will have a good glide path to normalcy, whatever that is, so that we're not caught with providing services we can't maintain. So there's just not enough resources out there to bridge all those funds when they expire. So that's all I have for today. And again, kudos to staff, all the departments, but especially this one because of all that funding that they're responsible for. Thank you.
Thank you, Commissioner. Now we have Commissioner Scholl and then Commissioner Schrader.
Yes, good morning, Mr. Cook and Mr. Johnson. Thank you for your informative briefing. Page 11, your FTEs with an 8.4 FTE increase takes you to 679.4 FTEs. Is that correct?
Yeah, 679.4.
Okay. Good. Okay. Next, in light of the 26-210 funding problem, money might not come in until third quarter of next year. Do you have some flexibility in the budget to ensure that rental assistance continues unabated?
I wouldn't say unabated. We are behind the scenes already looking at other funding sources that might be able to be repurposed for that effort. We'll be well under what we had budgeted in this budget, but we are looking for other alternatives because we don't want July 1 to be a mass exodus of people from housing that we have housed today.
Okay, so you're going to let us know if there's a glitch come the end of June?
Yes, I think, and again, the support we're getting from finance, county council, administrator, and some of the board members to work that issue, I think we'll all be finding this out in the next few weeks together. And I think we'll be able to come back with a solid plan.
Okay, thanks.
Thank you, Commissioner. Commissioner Schrader?
Yeah, can you hear me? My light is not going on.
Yeah,
Is it-
it's on.
It's okay? All right. So you can hear me. Yeah, to follow up on the Commissioner Scholl's question.
Speaking to your mic, Martha. Thank you, dear.
Okay, to follow up
Very
on
difficult
Commissioner
to hear.
Scholl's question, if we can go to 13, page 13, and I'm looking under social services, and the two largest chunks of money are developmental disabilities and then housing support, which is 12.5. Is there coordination between the Housing Authority and Housing Support, Rod? I mean, are they working together as we move through this homeless crisis in terms of not being siloed, for example? I'm wondering about that.
So my answer is absolutely yes.
Okay.
One of the things that the administrator, one of the first things he asked me to do was to look at some places where we could get better alignment, and that's one of the key ones right there. They had already been meeting for months, and Ed actually chairs a weekly meeting where those systems are coming together and looking for opportunity for better alignment. So we are 110% on top of that one.
Okay, thank you. I figured you were, but so I wanted to make sure we gave you some kudos for that, you guys. Okay, so the other piece of this is, does that 12.5 include the CARES and ARPA dollars and all the other largesse we're getting from the feds?
I believe it does include the CARES, the rental assistance funding, state funding that we received. I should double check to make sure, and I can get back with you. Is that not?
Yeah, because again, we're facing a situation, I'm looking at this, where we may need some bridge funding. We have these dollars structured within social services is the housing support piece where they have received money for rental assistance. So I'm just looking where that leveraging can happen as we move forward with, working with our housing emergency here and making sure people aren't out on the street, essentially.
Chair Parks, we have Brenda Durbin in the wings, so we may be able to bring her in. She may be able to answer that question for us right now.
Okay, and the other question I have is, is it the community of care group that with social services, aren't they the ones that decide where a lot of the federal and state funding goes?
Yes, that is an advisory committee, and then the staffing is currently with social services, but that's part of our alignment where you'll see some of that unit move and work more closely with housing.
Right. And I have looked at the community of care folks. It seems that it's largely professionals in the field and advocates.
Commissioner
I've
Schrader, I'm
wondered,
sorry,
which I think is good.
I can't hear what you're asking, Commissioner Schrader.
I think what I'm saying is, okay, when you look at our community care model, it's mostly professionals in the field, which is great, advocates, which is great. But I've looked at what Lane County has done, and I've looked at the mix of their community of care, and it really seems to be a great model. So I'm just going to throw that out there as a policy discussion. Maybe we need to look at that. Talk to some of the folks in Lane County, particularly Commissioner Farr. They've been very successful. Emily and I, back in the day when we were working more closely together, had looked at that structure and wondered if we couldn't actually, take a look at that and see if there was a more broader community involvement in that. So anyway, that is more of a policy discussion, but I think it's relevant because of the housing emergency that we're dealing with.
Okay. All right, thank you.
Thank you.
Thank you. Commissioner Fisher?
Yeah, thank you. So I have a question as well, and I just want to confirm that we're talking about the same thing. Whereas Commissioner Schrader said community of care, I believe it's the continuum of care.
Continuum of care.
Okay, just want to make sure, because my first
That's
question.
all I know it is a COC.
COC, I
so-
know, so I just wanted to make sure there wasn't another COC out there
No, there
that I
isn't.
was
There's
different.
Okay.
My first question is in relation to the performance measure related to the continuum of care. And now I want to find it. Okay, so it says, percent of
page are you on?
houseless individuals
What
served by.
page are you on? Excuse me.
What's that?
What page are you
Oh.
looking at?
5.
Thank you.
Percent of houseless individuals served by COC programs who move or maintain stable housing. And that looks really good because it has it at, projected performance is 85%, the target, and, we've met that, it appears. But I'm concerned that that doesn't give us a real picture of the need because there are so many people who are not served by our programs within Clackamas County. And so I'm interested in looking in the future as to what the percentage of people, what are we meeting the need? And I think that's going to be specifically, very, very important as we move into the support services measure, so that we know that when people call our coordinated access line and they are unsheltered, that they receive shelter. It's hard, there's a huge waiting list, we know that. And I don't know if you have those numbers as to the percent of people that are actually served versus those that need to be served, but I think that's important for this.
That is something we certainly go look into. I'm assuming we would have that data.
Yep. Well, we do because it's also in our local implementation plan, somewhat of the not necessarily all of the unmet need because it's hard to measure that, but at least the goals of what we're wanting to do moving forward.
Yeah, and again, we have Brenda Durbin in Zoom, so she may be able to answer these questions right now if you want to bring her in.
I can do that. She'll be in just a second.
Okay.
All right, Brenda, if you can unmute. There you go.
Good morning. I've been following the conversation. I understand that there's a couple of questions regarding the housing funds. For Commissioner Fisher, yes, the local implementation plan does have a nice analysis of the need versus the current capacity, and we can get that to you shortly. Commissioner Schrader had a question about the federal rent assistance. Yes, that is included in the social services budget. We anticipate about a $6 million carryover from this year to next year from our $12 million direct allocation. I don't believe that the current budget you have in front of you for next year includes the state allocation of $8.4 million, so that will be additional rent assistance available next year. And then, of course, we're awaiting the information from the American Rescue Plan about when those funds will be available. So just a little clarification about the coordination between the different funds. So while, yes, the Metro Supportive Housing dollars can fund prevention services, the majority of those funds will be to serve people who unfortunately are already experiencing homelessness. The federal rent assistance dollars are very much prevention. So those dollars are exclusively for individuals who are currently housed and need help paying their rent. So while there's some overlap, there's slightly different priorities, and all of the federal rent assistance dollars, those households need to prove that they did have an economic impact related to COVID, which resulted in their inability to pay their rent. And I apologize if I've missed some other questions.
Thank you, Brenda. That was
Thank you.
excellent. Couple more questions that I have. So through my work with the Association of Oregon Counties and our work with the legislature, one of our advocacy points has been in regards to developmental disabilities. Currently, case management is a very important service that's provided, but the state, and it's required that the county provide that, but the state does not reimburse us at a level that allows us to have caseloads to do the work. It's considered a workload model. My latest information is that this budget from the legislature is going to address that issue, and it's looking like there's support for that. When those dollars are approved by and this could probably be related to a lot of things that are happening down in Salem, then what is the process? I'm assuming it's not anticipated in this budget because it's not approved yet. Is that true?
I'm going to refer to Brenda again. She does our DD work. So Brenda.
So what we have in our budget for the DD program is a projection. For many of our state-funded programs, we don't actually know what our actual allocation is until after the legislature has adjourned, and that, of course, hasn't happened yet. So we have estimated next year's budget based on what we got the last biennium. But yes, if there are any significant increases in our case management allocation, those are not reflected in this budget.
Okay, and then that we go through a supplemental budget process when those funds become available, and then the county commission approves that per you coming to talk to us, and then the consent agenda?
Yes.
Okay, I just wanted to get that clarification. So my understanding of budgeting throughout my life as a public servant is that this is a plan of how, and it's really policy priorities of how we are directing our resources. And the details of it adjust as we move through the year. So where our priorities are, it's important that that is reflected in the budget. And I've appreciated the conversation and the questions regarding our alignment and our systems development and how that's all working. So we are definitely in transition in regards to our homeless services and our housing authority and our different departments. So I guess my question is, right now, or prior to this meeting, our housing authority was all separate. We have our housing authority board, we did all that. It was up on the dais back when we did it. But since COVID, we haven't been doing that. And now we were looking at the housing authority as part of the agencies, and now we're seeing it here. Do you see that in the future, the housing authority, because it's so integrated and intertwined with our social services, that will all be part of this larger budget process?
Yes, is my simple. We have, this is the first year that Housing Authority has been treated the way it is, and it's part of the one county model. It's part of us trying to streamline the services throughout H3S. It's gonna, so there's multiple pieces happening, but all of it is to create more alignment, create efficiencies, whether it be finance, whether it be programming. So the answer to that question is absolutely yes.
Okay, thank you. And I'm still mulling over in my mind. I appreciate Chair Smith wanting us to not, it was your chickens before they've been hatched? Count your chickens before they've been hatched. But I'm also very aware of the fact when it comes to the homeless services measure, that has been approved by the voters. The taxes are being collected. We do know that there will be revenue. We may not be able to anticipate how much exactly the revenue. We've been doing tremendous amount of in planning, not just for the local implementation plan, but prior to that, looking at Wilda Parks, because she served on the homelessness and housing task force that put together a whole list of recommendations, of which many are being implemented with the homeless services measure and the plan. And so I appreciate the conversation. I'm going to consider thinking about it, but I'm hoping that we have a robust conversation about what is our budget, what is the plan, where are our priorities as a county, and how can we make that commitment to the residents of Clackamas County. Not many, there's very few actually that are paying for the homeless services measure, but our high income earners in Clackamas County and our businesses that have income of over $5 million a year profit margin will be paying into that tax. We want to make sure that we are planning for the delivery of services as is expected, and I'm hoping that we have a good conversation about what this budget document means and what message we are giving to our community. And that's all I have.
Thank you very much, Commissioner. Christina, you have someone in queue?
Commissioner Savas has his hand raised.
Thank you.
Yeah, thank you. I just wanted to maybe, I in complete agreement, and knowing that we need to get all this in alignment, and to Commissioner Fisher's point, I think the Board of County Commissioners, even prior to Commissioner Fisher coming on the commission, was moving more towards this recognition and efforts towards the housing crisis and those that are, homeless and impoverished and struggling, and that situation seems to be getting worse, and so the resources are coming, and I think we made it very clear through all of our declarations and activities and budgeting that this is extremely high priority. So I appreciate the advocacy, but I do want to, I guess my question is, and I've raised this recently, and I'm really struggling. Maybe Commissioner Fisher can answer this question. The measure says that there shall be no more than 5% administration fee. And I recognize that, it's clear that our work, that there is a lot of administering, and perhaps it's going to be a lot larger than 5%, frankly. And as I see these dollars moving from Metro with their administrative fee, and then to our staffing, our administrative fee, and then looking back at some of the administrative fees that were incurred and dollars, spent legitimately by the nonprofits themselves who provide some of these services, that amount of administrative fees seems to be eating up a much larger portion of each tax dollar that the measure addressed in this 5% administration fee. So, Commissioner Fisher, what are your thoughts on our ability to meet the taxpayers who voted for this, that our administrative fees won't total more than 5%? Because it looks like it's beyond 25%, or will be beyond 25%.
Yeah, so Commissioner Savas, I appreciate the question, and I have to admit that was a long time ago that was on the table, and maybe Jill Smith has a better recollection than I do as the complete percentages, but I do know that there are differences between what Metro has to administer, looking at the overall regional program, and what each county has to administer, and maybe Jill can give more detail, or we can get that information at a future date. But honestly, there were a lot of details in there, and it was quite a while ago that we did that work, and I don't remember exactly what the percentages are.
Yeah, well, that's what, I'll just get to my second point I want to make, and that is that.
Oh, wait, hey, Paul, Gary had his
Just
hand up
saying,
and was going to respond to your question.
Thank you. Yeah,
Sorry,
Administrator
with all
Smith.
respect, Commissioners, you agreed to talk about this next Tuesday, June 1st. Staff is preparing you all the information you asked for on Monday, so it's a bit
Yeah, thank
premature to
you.
have that conversation today. Thank you.
Yeah, since it's not a budget we manage in this year's budget, and it's considering taking it out tomorrow, perhaps that conversation can wait for the board meeting.
Yeah, so anyhow, I'll conclude with my last comment, and that is we also have to recognize that staff has to stand up an organization. That means really start a business model, the work plan, and all the other things that make this all come together. So integration is great, but we've got a lot of work to do ahead of us. So I'm thinking that we're going to have to roll up our sleeves in a much greater way than we anticipated to make sure we can put this together, again, in the effort to make sure that as much of every dollar can make it to those who need it, in light of this crisis. That's all I have. Thank you.
Thank you, Commissioner Savas. Commissioner Smith?
I'm going to be brief in this. I just want to remind the board, we made a decision on Monday, and that decision needs to be honored. That decision will be held when we come to vote on this tomorrow. At question is the IGA through the 3 counties. In my discussion with the other 2 chairs of the other counties, they are equally not in favor of the IGA, and we are holding together on that in our negotiations. So therefore, passing the Housing Authority budget is not in our best interest at this time.
Yes.
We have time on our side for the Metro bond since there's no money there. Time is on our side, and we need to get this right. Thank you very much.
Thank you, Commissioner. Seeing no more lights or cards up, it looks like that's the end of all of our questions today, and I thank you very much for such a complete and concise report. This is one of the most important functions that this county offers, everything that happens through H3S. So we touch all people everywhere in the entire county with this, and we appreciate your diligence on it. Thank you.
Thank you for your support. We appreciate you much.